Hello, everyone. Happy Tuesday. Thank you so much for joining us. According to the American Academy of Dermatology, acne is the most common skin conditions in the United States, affecting up to 50 million Americans annually. 85% of young people between ages 12 to 24 deal with at least one minor acne. However, acne is also becoming increasingly common in adults, affecting up to 15% of women. What many people don't realize is that many foods and everyday products can actually have a negative impact on your skin, which can lead to acne. Also, not all the acne is the same. Therefore, it shouldn't be treated the same. That's why we're really excited today to be joined with Dr. Brooke Jeffy. Dr. Jeffy is a board certified dermatologist that practice out of Arizona and Kentucky. Dr. Jeffy specializes in patient education and the application of lifestyle strategies and integrative medicine to dermatology. So during this live, we're going to chat about common causes of acne, the types of acne, and the ways to treat it.
Hi, Jenna. How are
Good.
you?
How are you? Thank you so much for joining us.
Yeah, thank you for having me. I am just trying to figure out really quickly, hearing you a little bit better. Okay. Okay. Can you hear me okay?
Yes,
Sorry.
yes, it's perfect. It's perfect.
Okay, perfect. Yeah, well, thanks so much for having me.
Really excited. Tell us a little bit about your background, like how you became a dermatologist.
Yeah, so my path to dermatology was definitely not direct. I had an experience when I was younger dealing with a chronic illness, which put me at a young age in front of a lot of medical providers and experiencing a lot of procedures. And so that really was sort of like my introduction to medicine. Um, so I had that kind of in the back of my head as I was growing up, feeling like I had this unique perspective where it kind of made sense to go into medicine. And I always thought, okay, I'll be a gastroenterologist because that's the issues that I was dealing with. So started medical school and realized that really was not the field that I was interested in. So during the course of medical school, really decided I liked pathology, a very visual specialty, right? Looking at things under the microscope and relying on that visual memory to make diagnoses. So I found it really interesting and fun. And I actually started doing pathology residency out of medical school. But even with that, I kind of fairly quickly realized that I missed working with patients. And so that was a missing piece for me. Um, and then during pathology residency, I did a dermatopathology rotation where dermatopathology is the study of pathology related to dermatology issues. And as part of that training, we spent time in the dermatology clinic, allowing us to kind of put together the clinical and what we were seeing under the microscope. And I just totally fell in love with the specialty. It worked. It provided everything that I wanted as a visual learner. Both of those things kind of really hand in hand. So it was perfect for me. I was super fortunate to be able to switch residencies, which is not the easiest thing to do. So after I completed 2 years of pathology training, I went on to complete dermatology residency, which I finished in 2011. I did all of that training at the University of Louisville in Louisville, Kentucky. That's where I'm from. I practiced for a year there before moving to Arizona. So that's where we kind of get that Kentucky connection that you mentioned. So all my family still remains there. But I've been practicing in the Phoenix area for close to 11 years now. And recently, in July of 2022, I started my own practice. Within dermatology, my favorite thing to treat is acne in all ages. But I also really am focused on teen and tween skincare. with really the idea that if we can get kids doing a good routine on their skin, maybe they can avoid some of the negative things that go along with acne. So, ranging from scar prevention, but also just the mental health effects that sometimes people experience from acne. So I'm really passionate about educating those younger patients on a routine early on.
That is amazing. I don't think so many doctors are actually training pathology before going to their specialties. That's just like it's like a really hard field, and having that background is like amazing.
Yeah, it's great. It's a great background as a dermatologist. There's a lot of overlaps in the training. So yeah, I just it gave me a good background, and yeah, happy that it went the way it did.
You mentioned mental health and then teens and education, and I know your bio mentioned that you focus on lifestyle strategies and also integrative medicine to dermatology.
Mhm.
So what does that mean to you? How does that set you apart from other practitioners?
Yeah, so I really got to this interest. I mean, I didn't have this right away. It really was in the past 5 years or so where I got more interested in these sorts of applications. But basically, it kind of actually stemmed from another personal experience where having moved away from my family and also just in those early years of building a practice, just being super busy, not taking care of myself, since I'd moved, not really having so much support, and I just wasn't taking care of myself. So I started to feel really stressed and anxious and, maybe even a little bit depressed. And I kind of got to the point where thought, okay, I'm either going to have to see someone and really kind of get on some treatment, or maybe I can start trying to take a little bit better care of myself and see if I can avoid, like a prescription medicine, for example.
Mhm.
So I started exercising. I, for some reason, just decided I'm going to take up yoga. And I really just like committed to it. And, after a while, I started to feel much better. I just felt like I could cope with all these things a lot easier. And so when I was seeing patients, in front of me, they have these chronic conditions that they're dealing with, psoriasis or, eczema or their acne, and they're stressed about it. And so I just sort of really generically started talking to people about what they did in other parts of their lives. And, maybe they could start exercising to kind of get rid of some of that stress. Maybe they should sleep a little bit better, but again, just really generically. But it prompted me to try to learn a little bit about actual, evidence-based relationships between some of these things and some of these conditions. And so then also around that time, more was coming out about relationships with, things like psoriasis and cardiac disease. And, we know all these factors with nutrition and stress play a role in that. So, just kind of like this snowball effect, really. So I, really began reading all the research related to acne and trying to talk to my patients about all these other things they could do besides me just giving them medication. The problem is, though, that when you are working in the constraints of our medical system, right, our insurance-based medical system, you don't have the time. So, a lot of patients will say to me, well, okay, you're the first person that ever talked to me about this, or, most doctors don't care about nutrition. It's not that. It's that they don't have the time, to be able to make that a priority in the conversation. So, I was seeing, spending less than 10 minutes with a patient trying to get through all these things and educate them about how to use their medicine and their products and everything. You couldn't really get to that part. So, that's something we all have to kind of deal with in the future, but there's definitely this dichotomy between how we want to be helpful to patients and work on the preventative aspect, but the time, factor of it. So, when I decided really what happened was I started to feel like I was really missing the boat on some things with my patients, and other things were going on too, but it was time for me to make a change. And so when I decided to leave and start my own practice, I wanted to do it in a way that I could really holistically, treat patients that have the time. So I mean, what that means is that I work outside of insurance. And that's really the only way to be able to do this at this point.
Wow. I think your patient now, your current patients are so lucky to have you. And then really addressing also wide variety of issues related to their skin conditions, which will make also really optimizing their health and also more sustainable, or, not just like, treating it for the purpose of treating it, but actually maintaining it as well.
Right. And really gets into just overall, better health, not just necessarily related to the skin condition that I'm seeing them for.
Yeah. So back into acne, like I mentioned earlier, like over 15 million people actually struggle with acne. On the high levels, like, could you explain to us, like, what is acne?
Yeah. So very simply, acne occurs when there is blockage of a follicle opening on the skin or a pore on the skin. So that blockage can occur from oil that's excessively produced, or oil that's not removed, or it can be because of blockage due to like dead skin cells sloughing off, or debris from products that we put on our skin not being removed. And then really the oil just kind of like drags that all in there. But at the basic level, it's clogging of the follicle that causes acne.
Now, maybe this is a perfect time to answer this viewer question. We had someone asking, are facial oils a good or bad thing for your facial skin?
Yeah, facial oils can be good. Now, this gets into some complicated issues and some things that we'll sort of touch on a little bit later, I'm guessing. But there are certain oils that are comedogenic, and then there are some that are not. But again, that's not a black and white thing. So, but that plays a role in whether an oil may or may not be more helpful for the skin. But oils are great actually for really hydrating and helping this repair the skin barrier. It kind of depends on your skin type and other things maybe going on. But yes, oils can be very good.
You recently had a great post about specific acne types. Could you discuss like the different types and then what sets them different?
Yeah. So one thing I want to say first is that when I talk about acne types, I often include scarring and discoloration, which is really not exactly an acne type. Those are consequences after acne, but people really get confused by this. And so I will see a lot of patients who are still thinking they're having active acne. They're making all these changes, trying to get things better, when really what they have is the aftermath of acne that makes it all look worse. So I like to include that when I'm talking about acne types. But so we have discoloration and scarring, and then we have comedonal acne, and then we have inflammatory acne. So comedonal acne is generally, well, it's blackheads and whiteheads. Most of us kind of know what those things look like, but with a blackhead, what happens is the blockage in that follicle is close to the opening to the surface of the skin. So that opening it gets dilated. And so that material that gets stuck in there, the oil, whatever debris that it's dragged along with it, it sits there, it's chronically exposed to oxygen, and it turns black in this chemical reaction. So that's what gives us a blackhead. When we have a whitehead, the blockage is a little bit lower in the follicle. So the opening to the skin is not as dilated or wide. So you see more of a bulge, more of just like a bump in the skin. And then when we get to the inflammatory types of acne, so these are things like that really catch people's eye, the pimples, the pustules, the cysts, the more painful red lesions that people get. These are caused by the same mechanism of the follicular plugging, but we get inflammation from bacteria that normally lives on the skin. And we just get our body's response to that, and you get swelling and redness. One thing I also like to point out is that most people don't just have one type of acne. So you will have a combination kind of these things. In younger patients, we will sometimes see just blackheads at the very beginning, but usually people have a little bit of all of this going on.
Mm. How do you treat each?
Yeah. So there are some treatments that are a little more specific to each acne type, but it's a bit forgiving, particularly when we're in the over-the-counter active space. So even if you happen to diagnose yourself wrong, if you are using some of the over-the-counter acne treatments, they're still going to help you. Okay, they may just not be as targeted in their response. Okay, so when we are dealing with comedonal acne, so those whiteheads and blackheads, the things that we really want to reach for are salicylic acid, benzoyl peroxide, and adapalene. I know this, the post that you're mentioning that I had on Instagram, we didn't have adapalene on there, but salicylic acid, what it does is it really gets into the follicle. It's able to penetrate the follicle deeply. It breaks up oil and it breaks up all these, all the debris that the oil has taken down into the follicle with it. So that's kind of how the salicylic acid works for comedonal acne. Benzoyl peroxide works very similarly, although it doesn't penetrate the follicle as well. And then adapalene is a retinoid. So this is a great medication for acne that is now available over the counter. It used to be prescription only. But what retinoids do for acne is they help stabilize how the cells turn over in the follicle. So there's less risk of clogging. And they also gently exfoliate the skin to some degree, and they have anti-inflammatory properties too. But adapalene or a retinoid like adapalene is a great choice for comedonal acne, along with benzoyl peroxide and salicylic acid. With inflammatory acne, so remember, at the heart of all acne is that clogged follicle. So all those same actives that I just mentioned can be helpful, but then we also may start incorporating ingredients that have more of an anti-inflammatory benefit. So benzoyl peroxide actually has a significant anti-inflammatory benefit as well. So that is a great active to be using if you're having inflammation along with your acne. Also things like glycolic acid, lactic acid, those again still have some comedonal benefit, but also very anti-inflammatory. Hypochlorous acid is another ingredient that I like a lot that did not get onto the graphic that I had up, as well as azelaic acid. But those are also two great anti-inflammatory products to add into the regimen. Now, I'll talk about scarring and discoloration in a moment, but a couple of things that I like to point out too. So a lot of times they're neglecting some of the basics when they have acne. So they're maybe reaching for all of these products, but they're not doing the basics of what they need to be doing to take care of their skin. So, with marketing and everything, all these products have claims, look great, so you just want to grab them all, right? But what I try to encourage patients to do when they're starting to treat acne is focus initially on a routine of normal, healthy skin, which is going to be cleansing the face twice a day for 30 to 60 seconds. Take your time to really get that face clean, using a moisturizer and using SPF, okay? So that alone consistently will sometimes be very helpful for people. I will talk to people who are using all these products, but they're not taking their makeup off at night or something like that, so you've got to pay attention to that routine and stick with it. And the other thing is not giving products enough time to work. Mm-hmm. So I like to tell people they need to give any regimen that they're doing 3 months before making changes. But realistically, let's say you give it a month and then make one change at a time. So if you've got that routine down and you're still having, you're still breaking out, maybe then you go to an active cleanser and you make that change for a month. And if it's still not going the way you want it, maybe then you add a specific acne, leave-on treatment, okay? So you can't just ignore the basic and be throwing all these other things on. The other thing is that ingredients interact with each other. So we don't know exactly what happens when you're layering, 10 different products on your face. What that's actually doing to the potential usefulness of the product, really.
Wow. This is like,
I want to say one thing about scarring, or a few things really quickly about scarring and discoloration. So there are some specific treatments over the counter or actives that can be helpful there, but scarring, it's important to realize that that is a permanent change to the surface of the skin due to trauma to the collagen from acne for some reason. And then discoloration is not permanent, but it takes a really long time, like weeks, months, sometimes even years to fade. So for people that aren't familiar with this yet, when we get that discoloration, a lot of times it will start with redness, then it kind of fades to purpley red, which tend to linger for a long time and make things look really bad. And then it sort of turns to this tan brown and then kind of peters out. But there are some specific over-the-counter products that can help with the scarring and the discoloration. So retinoids, like I was mentioning, the adapalene, vitamin C, niacinamide, these things can help discoloration and also attempt to help the collagen change. So that is much harder to change. And then there's things like mandelic acid, which help with the pigment as well. It's also really important to use sunscreen when we are dealing with this discoloration, because that really chronic sun exposure drives that pigment to hang down. But if we are in more of that scarring category, there are a lot of things that your dermatologist can do for you in the office, procedures to help reduce that look, make it better for you. And then the last thing I just want to say about treatment of acne types is that if you are having more of the inflammatory acne, those deeper cysts, you're starting to see that scarring, please see your dermatologist, because over-the-counter treatment is just, it can help to a degree. It may be all that you need, but it's unlikely. So I just would encourage getting seen sooner rather than later.
oh my God, this is overloading amount of information.
Too much. I know, right?
I love it. We're gonna have to, everyone who's like viewing this, make sure to follow Dr. Jeffy and then save the post on different ingredients. I think it would be really hard for people to remember. So make sure you save that post. And then also remember having a really healthy skincare routine daily that will help with the prevention. And then lastly is, make sure you wear your SPF. And then if you have the inflammatory acne, make sure you see your dermatologist. I love this.
Great summary. Yeah.
I love this. You also had a great post about trigger of acne, so a lot of triggers on this list that I didn't really expect. So could you walk us through some of these triggers, why do they actually cause acne?
Yeah. So you're right. There were a lot of this generated a lot of comments. I think things that people really just didn't realize, like you said. So I'll kind of go through what we had on that post. So the first thing was wearing headbands or resting your hands on your face. You're just leaning and chilling like that. Both of these things cause friction to the skin. So anytime there's that friction, you're sloughing any dead cells around, jamming them into the hair follicles that are there, causing a blockage potentially. The other thing that just the act of these things sitting on the skin, you trap sweat, you trap debris, maybe products that you have used on the skin, or they're just kind of sitting there. And then again, oil that's there can pull those things in and cause, plugging of the follicles. So just the things to be mindful of in terms of things that we may use or habits that we may have. Sleeping and makeup, which is always my nightmare. But a couple of reasons that this is a problem: the occlusive nature. Makeup is meant to just sit on the skin, right? So that occlusive nature, holding things into the skin, holding debris, dead skin cells on there. But then when we sleep in it, again, a friction situation when we're on the pillow, we're driving all that in and across the follicle and picking up all the dead skin cells too. terrible for breakouts. And this is really the mechanism too, for which some people recommend silk, eye masks or silk pillowcases, because there's a much smoother, less pull across the skin. So I think those actually do make sense, but wash your face, get your makeup off before you go. Yeah. Then we get to products that are comedogenic, and this sort of we talked about for a second with that we had earlier. So I used coconut oil as an example in the post. So whenever you're breaking out, you definitely want to reach for non-comedogenic products, but comedogenicity refers to a product's ability to clog pores, and there is scientific testing that's done to come up with this number. It's a scale that rates comedogenicity of oils, or really any product, but coconut oil rates very highly on the scale. But that doesn't mean that any individual might not do okay with it. This is just a generality, okay? Conversely, Vaseline, which is an occlusive type of product, which can actually be helpful for some things, it's actually not comedogenic, but a lot of people just have this idea that it is because of the occlusive nature of it. But, again, it depends on the person. You can't say, oh, this is comedogenic, it's going to cause acne in everybody, and, vice versa. That's not how it works. So the next thing on the list was using products appropriate to skin type. So ideally, when someone is choosing cleansers and moisturizers, for example, they know roughly their skin type. Like, does it tend to be dry, normal, sensitive? Because if your skin is really oily and you are using hydrating products and really heavy moisturizers, you're not breaking up that oil that you make more of, then it's going to worsen your acne. And the same is true the other way. If your skin tends to be very dry and you're using cleansers for oil control and foaming cleansers that break things up more, you're going to get more dry and irritated and have more dead skin cells to clog up these follicles with. So important to at least sort of generally know your skin type and try to get products that are somewhat directed to that. Then we get to toothpaste residue, the phone screen bacteria, and just manipulating our skin. So picking and popping things. So all of these things, really, they're just causing irritation that further drives the inflammation of acne or contributes to changes in the skin microbiome, which is like a whole other topic I don't really think we want to dive into. But we get these changes that also then drive the acne. Not to mention that picking will lead to, scarring ultimately. And then the last thing in this graphic was food intolerances. And this is also a really complicated topic. So I'm going to try to break it down a little bit. So really there's two mechanisms by which foods contribute to acne. So one is they can cause inflammation in the gut, though these are things like dairy, meat, processed foods, sugar. They cause all this inflammation in the gut, damages our gut cells. All of these pro-inflammatory molecules get out. Maybe some of your listeners have heard of leaky gut. These inflammatory drivers get to the skin, among other places. They contribute to acne and damage to the skin. The other thing is that dairy and high glycemic index foods, they actually stimulate oil production through a hormone mechanism. So, just another way that they contribute to acne. So yes, just kind of a very high level overview on the food situation, but incredibly important when we are trying to control acne.
Amazing. We're going to have to invite you back to talk about the skin microbiome and also going more depth on like a gut health, because we have been talking a lot about food recently, and the whole inflammatory food is not just impacting our skin, but like almost like every body system, like it really impacts.
Exactly. So mental health, I mean, it's all related. Yeah.
Amazing. You have a couple practices. How does someone work with you, and then what does a session with you look like?
Yeah. So I am currently seeing patients in person in Arizona. So like the North Scottsdale, Phoenix area. I see patients in person and virtually if they live in Arizona. I am seeing patients currently just virtually in Kentucky, although that may change at some point to be able to offer a little in-person availability. Most of my appointments are 25 minutes. I like to be sure that we have time to make an appropriate diagnosis, go over things, start to make actionable steps in terms of lifestyle issues that we identify. But it is really, an ongoing process where we can continue to check in and follow up and make alterations and steps toward better health overall.
Love it. Love it. You also have a list of top skincare picks. Like, how do you come up with this list, and how do people get access to these things?
Yeah, so I keep a recommended list online at Shop My Shelf, which is linked in my Instagram bio. All of these products are products that I have used personally and had success with in my patients. So I also like to be sure that I have a variety of price points available. But on that list, a range of products from cleansers, moisturizers, different types of sunscreens. But I think, like I said, it's important to have options because with any individual person, it's trial and error, what works for them, what they how they like a product, if it smells okay, how it feels with their skin, all of these things. So it's definitely some trial and error.
And then make sure you give enough time, at least a month. And
Yeah, then of course, yeah, don't switch constantly, go slow, add things, yeah, absolutely. Exactly.
Anything else you would like to promote?
Yeah, so I mentioned that I love treating acne and that I love treating teen and tween skin. So I have been working on a project for the last 3 years that I am not quite ready to share a lot of details with, but it will be launching this fall in September. So if you are interested in being one of the first to know when that happens, follow me on Instagram or sign up for my newsletter.
Wonderful, wonderful. Okay, I'm going to make a note in my calendar and make sure I invite you back in September to talk about this new project. This is amazing. So thank you so much for giving us all these insight and all the information today.
Thank you so much for having me, Jenna. It was a lot of fun. Love it.
Totally fun. And everyone, thank you so much for joining. Be sure to follow Dr. Jeffy, and I will have all the information in the post promoting this Instagram live. So thank you so much.
Take care.
Have a good one. Bye.
Bye.